A very good morning all the way from New York. My name is Dr. Tenzin, and you are in the third day series of YouTube Live for the NEET PG. I know that almost most of the students, they're planning to take the NEET PG coming up in January. I know that you're nervous. For the last 2 days, we had the subject experts teaching anatomy and biochemistry, and today we have ophthalmology, one of the high yield topics that is going to be tested for the NEET PG, for which we have our subject expert, Dr. Vineet Sehgal. He has completed his post-graduation from Dr. R.P. Center of Ophthalmic Sciences from AIMS. After pursuing his fellowship in glaucoma, he is now the head of the department for glaucoma subspecialty at Sharp Sight Eye Hospitals. He is very passionate about teaching and has been coaching undergrads and postgrad students since his residency got over. His ophthalmic modules are very popular and have been consistently coaching NEET PGI and AIMS toppers in the last 4 years. His out-of-the-box thinking and personal mentoring approach makes him one of the most popular teachers in the recent times. So ladies and gentlemen, without wasting much of your time, I hand over to Dr. Vineet Sehgal. Enjoy.
Thank you, sir. So I'm Dr. Vineet Sehgal, and I would be discussing the strategies for the PG entrance exam. As you know, the NEET exam would be now 15 days from now. So we would talk about that how to counter the ophthalmology questions there. And also I would guide you some insight into how to prepare for those students who are trying to get into the NEET 2020 session. So I would thank Team Kaplan for giving me this opportunity. This webinar would have following topics in that. We would talk about the content to be read. We would talk about the smart revision techniques, the online tests, the test time management, the self-study, self-motivation, and then we would go into the ophthalmologic important topics and would discuss some controversies. So first of all, in ophthalmology, don't change the study material that you have done till now. Whatever book, maybe the UB notes, the Soch notes, if you have done my notes, so just concentrate on whatever you have done till now. Do the topics that are being asked previously. At least 3-year topics are very important. If you can just do the topics that are being asked in AIMS November 2018, the PGI November 2018, and the JEPMA. Remember, these questions are being set by the professors who are in the medical college. So they basically try to test your knowledge regarding the clinical ophthalmology. So those students who want to go for the NEET 2020 session, choose your book according to the basis of credibility, language, and the presentation. Let's say in your exam, you have 29 or 20 subjects. In 20 subjects, you have almost 250 days. You have to cover each and every subject. So don't do too much of voluminous books. Remember, you don't have to do a PhD in ophthalmology. You have to just basically crack the questions. So choose that book which has credibility, which has good language that you can understand, and the presentation is good. And also you can revise that also. Now some smart revision techniques. Always underline or highlight the points that you need to study again. What I mean by that, basically, let's say if you are studying a topic like retinopathy of prematurity. Okay, now there are 50 points that can be asked in the question. Now, just highlight those important points like zone 1, zone 2, zone 3. Then you highlight that what are the lasers that can be done. Then you can highlight what are the guidelines. So out of, let's say there are 3 pages of ROP, you have to just study only 50 important points. So it would help you in your revision. Let's say in revision, in your first thing, you have given around 5 days for the ophthalmology. In revision, you have to just give 2.5 days. So in 2.5 days, your volume of the book decreases from 300 pages to, let's say, 150 to 170 pages. So always underline or highlight the points that you need to revise again. Now, how many revisions are must? 2 revisions are at least important. Make note of the most common, the lines in ophthalmology, the ocular manifestation of systemic drugs, or the side effect of drug, and paste them over your table. So in the morning, when you get up, you see that points. So when something comes in your visual field, there are chances that you can basically remember them more correctly. Always remember that whenever there is an overlapping topic, what I mean by overlapping topic is that, let's say there is a topic of anti-glaucoma medication. Now this would be given in your pharma part also, and this would be given in your opthal book also. So just do that from a single book. Okay, so you don't need to revise it again and again from the dissimilar books. So if you want to do the anti-glaucoma medications from the ophthalmic point of view, just see the notes and then skip it from the pharma book. Now, always remember, some students ask me, sir, I am not able to remember the most common things or the drugs there or lines in ophthalmology, what to do? So remember that no one in the world has 100% memory. So whenever you revise, you would get into the great mode. And whenever you do 2 or 3 revisions, the chances of you getting the question correct are more. So always do revision. Make, if you are devoting 10 days for the ophthalmology, keep 5 days and then 2.5 days for the revision. The more you do the questions, the chances are that you would be better prepared at the exam time. Sometimes students ask me that, sir, how many mnemonics we should make? So what I would suggest to you is that mnemonics has to be made only for the facts. Don't make mnemonics for the concepts. Now, the thing is, let's say there is a ROP, retinopathy of prematurity. We have zone 1, that is the zone which is a dangerous zone, zone 2, which is a bit peripheral, and zone 3, that is the most peripheral. So this is a concept that you have to remember. Don't make mnemonics of each and everything, but yes, mnemonics are more important for those things. Let's say we have retinitis pigmentosa and the associations. So the mnemonic is Lucher. Okay, so this mnemonic is important or is useful for you to remember the associations of retinitis pigmentosa. So make mnemonics, but make small, simple, crisp mnemonics that you can understand. Don't make mnemonics for each and everything. Then some students ask me, sir, how many tests to be given, or in the last 15 days, how should we practice the ophthalmology? So remember, the online test and the grand test, these are a double-edged sword. Join a test series where you can get the feedback from the faculty. Remember, it's very important that you don't do that questions which are haphazardly made. Okay, so sometimes what happens is that there are some questions which are not properly made or not properly recalled, and you get confused because of these questions. So very important, join a test series, ask them beforehand that, sir, during the test series, if I have a doubt, I can ask a faculty. Only join that test series. Avoid too much of online content. And also it is important, let's say in a mock test you have got a 700 rank, don't evaluate yourself on this basis of 700 rank. Now some student may be an intern, some student may be of the same coaching institute, and some student may be of a different coaching institute. They may be at different level of preparations. So it is very important that how to evaluate yourself on the basis of these tests. So my important points are, whenever you give a grand test or you give a subject-wise test, let's say of an ophthalmology. So remember these questions. Were you able to complete the test in time? What does this mean? That let's say you have got 100 questions, out of which are you able to complete these 100 questions 15 minutes before the stipulated time? How many questions you did wrong because of your silly mistakes? It is very important. Let's say in 200 questions, you did 3 or 4 questions wrong. So 3 or 4 questions wrong, that should have been done right because of your knowledge. So that means 15 or 20 marks below your competitor. And that means a lot. When I got AIMS rank 47, the best thing in my preparation was that I just got one silly mistake. And even then, if I have not done that from ophthalmology, maybe I have got into the dermatology. So every question counts, every number counts. Evaluate your score and rank, but don't get motivated or demotivated by it. Remember, these ranks are just of a subset of students. Okay, these ranks don't tell you that what you stand in a 1 lakh 1 lakh students who are giving the test. Now, also important is that let's say you have got a test series of 200 questions, and out of that you have done 120 questions correct. Now, very important is don't study the explanation of each and everything. Just study the explanation of those questions which are important, which you have done wrong, or that are in your blind spot. Okay, so let's say if they have asked a question about anti-VEGF and you have not studied about anti-VEGF in your retina chapter. Now, this is the time to go back to your book or go back to your notes and study about the anti-VEGFs. So evaluate the test series very carefully. Don't think that, let's say, if there is a question of eyelid disorders and you have already read eyelid disorders from your notes very well, so don't need to see the explanation again and again. Now, time management is very important. Dr. Tenzin would be telling you more about the strategy for PGME. But as per ophthalmology is concerned, I would say that still 10 to 15 questions in that, still I would consider as a minor subject. So don't need to give 3 days for this ophthalmology. Just give 4 hours a day in 2 or 3 days to revise the important points. Always when you end a day, you see yourself that if you can increase the input by just 5 minutes, what is the time when your concentration is low? Is it after lunch or is it in the morning? So try to improve yourself. Okay, don't waste your time in discussing the controversial questions or most common or etiology type of questions. One example that I want to give you in ophthalmology, there is so much of controversy regarding what is the most common inheritance pattern in the retinitis pigmentosa. Now, this question was once asked in a state entrance exam. Many in Kansky, they have given another reference. In other things, they are given other reference. So don't get into the fight with the faculties or with other students just on the basis of what should be the correct answer. Leave it. Just have a faith on one faculty and go ahead. Don't waste the time on unnecessary questions. Now, very important for ophthalmology is self-study. 80% of the time you have to devote to just read the facts and read your notes. You can use a guidebook also. There are so many guidebooks in the market. But remember that whenever you are preparing with the notes, especially in ophthalmology, you have to supplement your notes with the questions that have been asked. So I would just give you an example that in the notes that we go in our coaching classes, they have not given vertical gaze paralysis or executive type of bifocals. But this was asked in the exam in AIMS November 2018. So it is your duty that now this question is asked, the chances of this question or this topic to be repeated are more. So just write the question or the important points in your already existing notes and supplement it. So in this way, the thing is that you would get all the material in one place. So otherwise, what would happen? You would get something from the videos, you would get something from the class notes, you would get something from the PGME guides, but you are not able to compile it in the end. Okay, so that is very important. And the important thing is get out from your comfort zone. Some students say that, okay, I need 8 hours of sleep. I want to go to gym also. I want to see this picture also. Very important. If you have to be topper, you have to be better, not just good. So get out from your comfort zone. Only then the things can be better and things can be different. Now, opinion regarding some standard textbooks. I would say for ophthalmology, during your preparation time, you don't have to study Parson and Khurana. You just concentrate on guidebooks, on ophthalmology notes or your coaching notes. That is more than sufficient. For image-based questions, you can study Parson or you can see Kansky, but don't read whole of the standard textbooks during your exam. Now, some students ask me, is the preparation different for different exams? I would say no. Remember, the topic is the same. They can ask questions differently in different exams. I would just give you an example of retinal detachment. The question about retinal detachment has come in AIMS also, it has come in JIPMAR also, and it has come in PGI also. So the topic is same. So whenever you study retinal detachment, basically study it fully. do all the points, do write all the points, do note all the points, do revise all the points that are being asked. So if you do different type of preparation for different type of exams, the chances are that you would lose precious time and you would get a lot of stress in your mind. So according to me, and according to everyone I have seen as a topper in the NEET exams, in the AIMS exam, in the PGI exam, what they are doing is that they are getting good marks in each and every exam. So the reason is that they prepare the subject fully. If you have good command over your subject, the chances of you getting a good rank is very high. Otherwise, if you do just previous year question papers and you are just not doing the topics, only seeing the questions, the chances are that if they modify the question a bit, you may not be able to answer it correctly. So very important for this is whenever you do a subject, whenever you do a topic, do it more clearly. Especially for the PGI exam, what I would refer to you is just do the previous year questions very carefully. They are in habit of repeating their questions again and again. So at least 3 years PGI papers are very important. Now, motivate yourself. Sometimes I get the students' opinion that ophthalmology is a very tough topic. It's a very tough subject. So we should not do this properly, or maybe there are 7 questions. Even if we read it for 7 days, we may not get good marks. So always be in good company. Always talk to the positive people. Don't talk to the negative people. If you are doing an internship or you are doing let's say medical officer duty, you have to manage your time very properly. Make realistic targets and try not to change your timetable again and again. And one saying that I always tell to my students: make reasons for your success and not excuses for your failure. Now, very shortly, I would tell about some special issues that are being faced by the internship students or medical officers or who are in the private job. This question was asked me a few days back. So basically, those students also, maybe this is your first attempt, but don't lose hope. Divide your time in between your duty where you can study. Try to give 6 hours a day to studies after your duties. On your holidays, you can give 12 to 14 hours as well. Any doubt you can solve in our module, and don't go for too much voluminous books. Remember, the revision is more important. A very famous saying in PGME: do a small book 10 times. It is much better than doing 10 books one time. Okay, so revision, revision, revision is must. Now, friends, we would talk about some important topics in ophthalmology. Ophthalmology usually contains 10 to 15 questions in NEET PGME. It is a rank deciding subject. In out of, let's say, 15 questions, you are able to do 12 questions in a go. That would give you a upper hand over your competitors. Okay, and out of 15, if you are not able to do even 10 and you have done only 5, so this would be the rank decider. Toppers always have good marks in ophthalmology. Remember, what ophthalmology needs is continuous revision and lot of MCQ practice. I have seen so many students who were very good at theoretical knowledge, but they were not able to solve the MCQs. So very important is you study and revise each and every MCQ. Do a lot of MCQs, do thousands of MCQs. The more the MCQs you do, the more the command you get in the subject. Very important for topics like neuro-ophthalmology, squint, and refraction. You may be good at the theory, but when they give you the numericals, you are not able to solve that. So it's very important. Remember, don't do too many voluminous books. I have told about this earlier also, but do an image-based study. What I mean by image-based study is that, let's say we are doing a topic of congenital glaucoma. So you are studying, yes, this is the triad of congenital glaucoma. It has photophobia, it has lacrimation, it has so hypstria. So at that point of time, when you are studying about the congenital glaucoma, see a photo of child having ophthalmos, a large eye, and hypstria in it. So what it would tell you is that these signs you can correlate from the picture into your virtual memory. So you would never forget that. Some students do they do is that first they read all the notes. Let's say for 3 days they are reading everything, and after that what they are doing is that now they are focusing on the images. So according to me, this is not the right approach. And second thing is that won't build your concept. Also important, this thing is for the third year students or the fourth year students who are seeing our video, that you have to make concepts. And don't get confused by the image based questions. They are the easiest. Look, what is ophthalmology? Ophthalmology is basically eye, the vision that you see, the image that you see. If you can correlate with the options, it is the easiest thing. So don't get scared by the visual based questions. They are the easiest questions in ophthalmology. Now friends, we would discuss about the important topics that are being asked chapter wise. First, we come to the retina. Retina is one of the most important topic. If you get around 10 questions in ophthalmology, 2 or 3 definitely would come from the retina and sclera. Retinal anatomy, this time in AIMS exam, they have asked about the histology, the slides where they have asked about the inner plexiform layer and the outer nuclear layer. So it's very important to you do the retinal anatomy correctly. Diabetic retinopathy, very favorite question of the examination. So do the pathophysiology, what are the factors that causes the diabetic retinopathy, what is the ATDRS classification, and what are the treatment strategies, where you have to do laser and where you don't have to do the laser. Then retinal detachment, a very important topic for JEPMAR exam. Remember, what is being asked in JEPMAR can be asked in the NEET PGME also. So retinal detachment, types, clinical features, and treatment, that is all very important. Then they can ask a question about the retinal fundus dystrophies, and the most common question they ask about the retinitis pigmentosa. So retinitis pigmentosa, very common in Indian population. It is the most common hereditary fundus dystrophy. So do that very well. Investigations, they have asked in your AIMS exam, and they can ask in the NEET exam also, the ERG and the multifocal ERG, very important. And remember, electrooculogram, they sometimes ask because they want to ask the question regarding what should be done in the best dystrophy. Now, ROP, one of the favorite topics that has been asked again and again. Remember, the guidelines for ROP has changed, and you have to remember that now the guidelines are 34 weeks and birth weight, that is 2000 gram. Earlier it was 1500 gram and 32 weeks. So this change in guidelines you have to remember. New drugs for the retina like anti-VEGF subretinal implants, ARMD, they have asked about, they are asking about the FA pictures. You may get a picture regarding the FA picture of ARM, dry or wet ARMD now. So you have to remember ARMD. Photodynamic therapy also they have asked earlier. So you can get a question on that. Retinal manifestation of systemic diseases is very important. They have asked about the dengue last time. They can ask about the HIV. They can ask about the Zika virus. Very important. Then endophthalmitis, one of the favorite questions of the PGI exam. Do each and everything about endophthalmitis. Once in NEET exam, they have asked about the scleritis also. So the blue sclera, you have to know the differential diagnosis of blue sclera, the difference between the episcleritis and scleritis, that are very important. Now I have got 2 questions from the students. So one question was how to solve and deal with the image-based questions. So this is an important question. Now remember, in retina, there are 3 things. Okay. One thing is that there is an optic nerve head and there is a macula. So remember 3 colors, that is red, yellow, and black. The red color signifies hemorrhage, the yellow color signifies exudate, and the black color signifies any laser or pigmentation. Now, when you see these 3 colors, now correlate these 3 colors with the options they have given in your question. Let's say they have given a picture of retinitis pigmentosa. So what you would get is some black pigmentation in the periphery. So when you see black pigmentation in the periphery, you say, oh, this is a pigments. So the answer can be retinitis pigmentosa. So this is the simple way of doing fundus based questions. So best recommendation, the second question is from Mr. Manish Kumar. So best recommendation to solve image-based questions, I would say that you have to, whenever you are studying that topic, you have to see the image at that point of time also. So what I have done for my students is that I have made separate visual-based ebooks for each subject. So read the chapter, after the chapter, when you read the chapter, see the images that can be asked. So in this way, you would get the concept also, and also you would get into the details and you would never do that question wrong. The third question by Dr. Nilesh Katke is how to deal with OCT images. So remember, OCT images is very important, that you have to see that what is OCT. OCT is basically a biopsy of the retina. So the topmost layer is internal limiting membrane, which is in connection with vitreous, and the bottom layer is the retinal pigment epithelium that is in contact with choroid. So now in these 10 layers, you have to see where is the pathology. If there are small cystic pouches here and there in the middle layers, then this means that there is a cystoid macular edema. Okay. Now in the macula, if there is a defect in the center, that means it is a macular hole. Okay. Now I told you that retinal pigment epithelium is in connect with the Bruch's membrane of the choroid. So if you find some vessels, some red lines that are breaching the RPE, this means that this can be age-related macular degeneration. If you are just seeing an elevation of RPE and getting a black space in between, this means you are having a central serous retinopathy. So in this way, you have, what you do is, what my recommendation at this point of time when 15 days are left for PGME, what you do is you just make a list of the pathologies of retina and see the OCT image. So this is CSR, this is the OCT image. This is the wet ARMT, this is the OCT image. This is the cystoid macular edema, this is the OCT image. So that would be better. Okay, so now we are over with the questions. Then the second topic is cornea. In cornea, corneal anatomy and biochemistry, as you know, is important. The most questions they are asked in NEET PGME is regarding the corneal ulcer. Sometimes they ask about the bacterial corneal ulcer. Sometimes they are talking about the fungal corneal ulcer. Sometimes they are giving a clinical situation like regarding the acanthamoeba, or they are giving about the nocardia. So it is very, so this is the question also. Does bacterial ulcer resemble fungal ulcer? So yes, sometimes they ask confusing clinical history. What they do is that they ask a question that a corneal ulcer has come to the patient. The patient has come with the features of, let's say, satellite lesions or hypopyon, and they want to ask that what is the diagnosis. So you have to remember about the fungal ulcer and see what are the hints given in the question that resemble the fungal ulcer. Remember, one important thing is that nocardia, acanthamoeba, and pseudomonas, all these three can basically mimic a fungal ulcer. If they ask the onset is very short, let's say 24 hours, then go for pseudomonas. If they have not talked about anything regarding the onset, go for the acanthamoeba. If acanthamoeba and pseudomonas both are not in the option, go for the nocardia. Then corneal dystrophies, they have asked in AIMS, they have asked in the NEET exam also. Don't have to go each and everything regarding the corneal dystrophy. Just remember the stains, like a mnemonic, we call it MAC, that is the macular dystrophy, you use Elchin blue. For granular dystrophy, you basically use meson-trichome stain. Also remember what is the most common corneal dystrophy, that is the Kogan-Map print dystrophy. Also remember what is the most severe dystrophy, and also know about what is the treatment. Remember the layer that is involved. Let's say in Fuchs endothelial dystrophy, you have the layer involved, that is the endothelium. So what you do is just remove that endothelium and put a layer in that place. So that is called DSET. That is the Desmond stripping automated endothelial keratoplasty. Eye banking is important. Remember that RPC is very fond of asking about the questions. So you should have a good knowledge about the media that are where the cornea is stored. What are the recent protocols? What are the contraindications for corneal transplant? Then they can ask about the band-shaped keratopathy, arcus senilis, Moorans ulcer. Keratoconus is also a very important topic. Last time they have asked a question regarding the corneal tattooing. So you have to remember the indications for corneal tattooing as well as the stains that are used. Cornea verticillata, they have asked last year. So you should know the drugs that cause cornea verticillata. Also, you have to remember that what are the implications of corneal verticillata. Remember, the cornea verticillata does not cause impaired vision, so you don't have to treat or do a lamellar keratoplasty in that case. Another important topic is pterygium. So many times asked, you have to remember A to Z about pterygium. Also, they can ask about the investigation of choice in the cornea. So remember the esthesiometer, the pentacam, the confocal, and the specular. They can ask where the specular is used. They can ask where the pentacam is used. Now, time for a few questions. So the question is, sir, does angle subtended by largest letter at 60 minutes of arc? So this is a question I would discuss in my optics segment. Now we come to the lens. In lens, they have asked about the metabolism. Remember that cataract is bread and butter for an ophthalmologist. So they would definitely ask a question regarding a cataract surgery. They can ask what are the new trends in the cataract surgery. So remember the femto laser. I talked about femto laser 3 years back, and now each and every exam they are asking about the femto laser. The new trend is zepto laser. Remember the zepto laser, you can do a capsulorhexis, but you cannot do the other steps like corneal incision, the nucleotomy with the zepto laser. It's a new technique. Remember what are the complications of cataract surgery, and also remember the miscellaneous cataracts. They can ask that which type of cataract you get in atopic dermatitis. You would tell, sir, I would get a shield cataract. They would ask which type of cataract is reversible. You would tell that, yes, sir, this is the all droplet cataract that is reversible. They can ask various causes of ectopia lentis. They can give a picture of an intraocular lens which has many rings in between that. You would tell, sir, this is a multifocal intraocular lens. And they can also ask about the congenital cataract. One controversy regarding congenital cataract is that what should be the ideal time to operate. So nowadays, whenever you see a congenital cataract, operate it. Just ask your anesthetist that can you give GA to this patient, and whether it's a unilateral cataract or a bilateral cataract, doesn't matter. You have to operate the child as soon as possible. And they can ask what is the best treatment for congenital cataract. You would say lens aspiration with posterior chamber intraocular lens. You don't have to leave this child aphakic. Only those children who are less than 6 months of age can be left aphakic because there is a lot of refractive surprise. But if any child is more than 2 years of age, you have to put an intraocular lens in that. Then we come to the conjunctiva. Conjunctivitis is a favorite question in NEET. You have to remember the types of conjunctivitis. You have to remember neonatal conjunctivitis, that is the ophthalmia neonatorum. They have asked about the hemorrhagic conjunctivitis. So it's a small topic. You have to just remember from the notes. Important thing is remember about trachoma. The new development regarding trachoma is that now India is free from infective trachoma. Some students ask me, sir, we get so many patients of trachoma in the OPD, how it is eliminated? So it's the infective trachoma that we have eliminated till now. So it's an important topic. And nowadays you get so many of acid attack victims. So remember the ocular complications of the chemical injury. Read about symphoniclone, read about ankyloblepharon, read about the treatment of dry eyes, which is nowadays very prevalent, and read about xerophthalmia also. So for xerophthalmia, you have to remember that 50 points that are being asked in the exam. Don't go into too much of details. You have to know about the primary signs, you have to know about the secondary signs, you have to know about the treatment modalities, you have to know about when to treat, what is the prophylaxis, and where to treat. Uvea, a very important topic, uveitis. Remember this thing. If they ask drug of choice for any type of uveitis, let it be hypertensive uveitis, acute uveitis, anterior uveitis, posterior uveitis, intermediate uveitis, drug of choice is steroids. The second drug of choice is steroids, and the third drug of choice is steroids. So never ever mark anything except steroids when they ask about the uveitis. Just, I am basically a glaucoma consultant. We are a multi-specialty high hospital with almost 10 to 15 uveitis cases per day. Don't think that steroids are not to be used because they can increase the IOP. Just trust me that the percentage of patients who get a raised IOP because of steroids is very less. And second thing is they can be managed easily. But uveitis is inflammation. Unless you decrease the inflammation, you won't get the relief. So drug of choice is steroids, steroids, and steroids. You have to remember the names of the white dot syndromes because this can be a tough question. Just remember the 7 white dot syndromes that are being asked. You have to know about what is phacomatoses. These are basically tumor-like lesions which have systemic manifestations as well as ocular manifestation. The question like Sturge-Weber syndrome, tuberous sclerosis, neurofibromatosis that are being asked. So please remember the 5 or 6 phacomatoses that are important. Sympathetic ophthalmitis, very important. The common controversy is that what is the most common sign in a sympathetic ophthalmitis? Remember, the most common sign is retrolental flare. If they ask most common symptom of sympathetic ophthalmitis, according to me, the answer should be problem in near vision. When we used to be in RP center in the trauma unit and we operate a patient of, let's say, corneal perforation, during my rounds, my professor used to ask me, Dr. Vineet, what have you done in the workup? Then I said that, okay, sir, I have done a good repair of the right eye corneal tear. And then he asked me, have you taken the vision in the left eye? So I said, no. So that is the point. They want to emphasize that whenever there is a early stage of sympathetic ophthalmitis, the sign would be decrease in the near vision of the other eye. So remember, the most common sign is retrodental flare and the most common symptom is decrease in near vision. Then Fuchs heterochromia and posterior and the sorry, it's not posterior, it's Poschner-Skolzmann syndrome. They are also they can be asked. So remember just 5 or 6 points that Amsler sign is seen in Fuchs heterochromic iridocyclitis and in Poschner-Skolzmann in young age unilateral involvement, and you get a lot of raised IOP. Now, time for a few questions. So, now regarding ophthalmology instruments. So instruments, now you know about the ophthalmology, it is one of the most high yielding branch nowadays. A lot of instruments are coming. So you have to know about fluorescein angiography. So many questions they have asked about the fluorescein angiography, and you must be getting 1 or 2 new instrument each and every day. So the important instruments that you have to remember is specular, that is needed to do the endothelial count, the ICG that you have to do in a patient where you suspect a choroidopathy, fluorescein angiography you have to do in those patients where you are suspecting a retinal vascular disease. You also have to remember the what are the various FA pictures. They have asked about the NPDR. Remember, if they ask about the PDR, that is a proliferative diabetic retinopathy, you would get fronts here and there. Okay, do Remember the ophthalmoscopes. There are two types of ophthalmoscope, the direct ophthalmoscope and the indirect ophthalmoscope. Read the 7 or 8 important points. Do about what is gonioscopy. Gonioscopy is instrument of choice for getting into the angle closure glaucoma. So if you have to diagnose an angle closure glaucoma, the investigation that you have to do is gonioscopy. Then keratometry. Keratometry can be done by the placido disc keratoscopy as well as pentacam, obscan, or a cirrus. If they ask investigation of choice for a keratoconus or investigation of choice for the LASIK surgery, you have to go for pentacam. If pentacam is not in the option, go for the obscan. If obscan is not in the option, go for cirrus. The duochrome test, they can ask, you would tell, sir, to get into the spheric, to refine the spherical power of the glasses, we need a duochrome test. They can ask about the Worth-Ford dose test. You would tell, sir, they are used for getting a knowledge regarding the binocularity and suppression. The retinoscopy, they can give different values, let's say a -2 diopter and -3 diopter, and they can ask which type of astigmatism it is. So you have to know different type of astigmatism, what is with the rule, what is against the rule, what is the simple myopic, what is the compound myopic, and what is the mixed astigmatism. You may get a question on this. Then stereopsis is basically 3D image seeing. So what are the things that make the stereopsis, and what are the tests that can be asked for the stereopsis? You have to know. Color vision evaluation test, we are gone with the Ischera, but nowadays Nagel's anomalouscope is a very sensitive test. Few years back, they have asked about a picture of the Fensel 100 hue test also. So please do that. Visual fields, remember, they have now, recent trend is they are not asking about the glaucomatous visual fields. They are asking about the non-glaucomatous visual fields. Like altitudinal field defects you get in AION. The keyhole defects you get in vascular lesions of lateral geniculate body. And in, let's say, hemianopias, you get in pituitary adenomas. So please do the specific pictures. Please see my videos on the glaucomatous and non-glaucomatous visual field defects. There can be a question on that. They can ask about the Amsler-Dubois and Amsler grid chart. Don't confuse between that. The Amsler grid chart is basically used for the ARMD, and Amsler-Dubois chart is for the depiction of the retinal detachment or any picture in the retina, like hemorrhages, lattices, all like that. In the optics, which is an important topic, you can get questions regarding eye measurements, that is included in Gulfstrand eye or the reduced eye. You can get questions regarding the pupil abnormality. They can ask about Eddy's pupil, Horner's pupil, Hutchinson's pupil. They can ask about the refractive errors and their salient features. So the myopia, the hypermetropia, the presbyopia, and the astigmatism. Remember these things. They can ask that what are the correction that can be given in presbyopia. So it's a common confusion in these students, that what should be given in presbyopia, what is the ideal prescription to be given. So remember, for giving an ideal prescription for a patient, let's say a 45-year-old guy who has come to you and he is saying that, sir, I am a shopkeeper and I'm not able to see the bills in my shop. So what you would do is you would put convex lens in front of it, and you have to ask that at what distance you are working. So one person may be having difficulty at 40 centimeter, but his work is at 25 centimeter. And one person may be working on computer at one time, mobile at other time, or a case sheet at other time. So you have to give progressive glasses in that. When the patient has multiple focal ranges, you have to give those glasses which can see at multiple points. Otherwise, let's say they have not given the distance, then how to give the prescription? So the basic rule is at 40 age, you give a prescription of 0.5 to 1 diopter. At 45 years of age, you give a prescription of 1 or 1.5 diopter. At 50 years of age, you give a prescription of 1.5 diopter to 2 diopter. Now, let's say you have not got even the range, then how you can answer? So go for the higher side. So at 50 years of age, go for the 2 diopter. At 45 years of age, 1.5 diopter. At 40 years of age, 1 diopter. But the best thing is that you do a refractive correction, do a retinoscopy for that patient, and ask the patient that what is the convenient distance for you, and then give the glasses. Then they ask about the angle kappa. Remember, why is angle kappa important? Because it is the only angle. We have different angles. We have angle gamma, we have angle alpha, but kappa is the only angle that you can measure. So you have to remember about the angle kappa. Prescription of glasses is also important. So whenever, what they can do is that one doctor has done a retinoscopy, let's say at 1 meter of distance, with a cycloplagia of atropine, and he has got a -3 diopter sphere as the prescription. What, or as the retinoscopy, what should be your final correction? So your final correction would be -3 diopter. Also put -1 diopter for the atropine and -1 diopter for the distance of 1 meter where you have done the refraction. So the final correction comes as -5 diopter. Then they can ask about the astigmatism, that let's say in the horizontal axis there is -3 and in the vertical axis there is 0. Now what should be astigmatism? So if the one axis is having -3 and other axis is having 0, then it is a simple myopic astigmatism. Now if they ask about, let's say, so if they say that, let's say this is -3 diopter and this is +1 diopter in the retinoscopy, what is the type of astigmatism? You would say, sir, this is a mixed astigmatism. And with the rule or against the rule? So as you know that in with the rule astigmatism, the vertical axis is more curved. So this is with the rule astigmatism. So to practice astigmatism, you have to do more and more questions. Now we come to the strabismus. Basically, strabismus or squint. So many students ask me, sir, this is a difficult topic. But remember, the questions that are being asked in strabismus or squint, they are usually easy. Okay, the text is difficult, definitely, but the questions are not so difficult. So I just erase all this, and we come to the strabismus part. So the important things that you have to remember is the extraocular muscle anatomy. And the most important extraocular muscles that you have to remember is superior oblique and inferior oblique, because these are not the straight muscles, these are the cyclovertical muscles. Remember about the pseudo squint. Remember about the visual acuity in children. Sometimes they ask that what is the visual acuity of a children attained, and or what is the age at which a child get a 6/6 visual acuity. So normally, if in AIMS exam they would ask this question, they would also ask that what is, or they would give that what is the instrument through which they have measured. So remember, if they have not asked anything, any specific instrument, and they are asking about at what age you get 6/6 visual acuity by the Snellen's chart, your answer should be 3 years. Okay. Then they can ask about the eye movements. They've asked about the nystagmus, the cerebellar control of nystagmus. Earlier, they have asked about the nucleus of Kagel. So remember the various type of eye movements like saccades, like pursuits, the optokinetic nystagmus, and what is their supranuclear control. Also, the most important topic or the most common question they asked about is regarding the sixth nerve palsy, the superior oblique palsy, and third nerve palsy. So always remember the 9 gazes that are there and see that at which gaze there is a face turn or head tilt. So for superior oblique palsy, I would give you the mnemonic. So if you do like this is called face turn. Okay, so this is a face turn and this is a head tilt. Okay, so this is a face turn and this is a head tilt. So in superior oblique palsy, you remember two mnemonics. One is boot and other is voog. That is better on opposite tilt and worse on opposite gaze. Okay, so a person, let's say with the right superior oblique palsy, he would come with the left head tilt. Okay, so right sided palsy would come with the left head tilt and worse on opposite gaze. So better on same gaze. So right, let's say right eye palsy, he would come with right face turn. So left head tilt and right face turn. So this is the important mnemonic that you have to remember in superior oblique palsy. Also remember regarding the third nerve palsy, where there is a down and out position of the eye, and sixth nerve palsy, where there is a difficulty in abduction because lateral rectus, that is the sixth nerve is paralyzed, and you can get a slight esotropia in these cases in long standing lateral rectus palsy. Then in PGI, they can ask about the AV pattern squint. I don't think that this is a tough question. You can see in my videos also on YouTube regarding the AV pattern squint. But remember that this is horizontally comitant and vertically incomitant squint. Okay. So you have to remember what is comitant squint and what is incomitant squint. So if you are getting a squint in all directions, this is called comitant squint. If you are getting a squint different in different cases, like in paralytic palsies, so that is called incomitant squint. Then you can have DRS, that is the Duane retraction syndrome, where in type 1 there is abduction limitation, type 2 there is an adduction limitation, and in type 3 there is both abduction and adduction limitation. So these are some important topics that you have to just revise before the NEET exam. Now I just do erase things. I think we are on time and we have just 10 minutes left. I see any questions from your side? No questions, so let's go forward. So now we come to the neuroophthalmology. In the recent exam, they have asked about the types of optic neuritis. So you have to remember the different types: the papillitis, the retrobulbar neuritis, the papilledema. Always remember that whenever they give a question regarding the papilledema, you always have a bilateral papilledema. Okay, so for papilledema, it is very important that you get a bilateral involvement. And what is pseudotumor cerebri? The pseudotumor cerebri, here you get a raised intracranial tension, you get a papilledema, a disc swelling, but you don't have any intracranial space occupying lesion. So you have to remember the causes of pseudotumor cerebri. Also, they can give the question in a language like they are just giving you that 50-year-old female with thyroid comes with blurring of vision and headache, and you get a disc edema both eyes. What should be the next course of action? So you would tell control the thyroid and decrease the weight, or just control the weight gain. So many times they have asked about the questions of internuclear ophthalmoplegia. Please do that very carefully. They have asked about the Foster Kennedy syndromes. You have to remember which type of tumors causes Foster Kennedy syndrome. The Leber hereditary optic neuritis, you have to remember. The anterior ischemic optic neuropathy, they have asked about the type of visual field defects. So you would say, sir, altitudinal field defects you would get. In multiple sclerosis, they ask which is the most common ocular complication you get in multiple sclerosis, and you would tell, sir, it is optic neuropathy. They have asked a question about the toxic optic neuropathy. You would say, sir, vitamin B12 is used in cases of the tobacco-induced optic neuropathy or tobacco-induced amblyopia. And as I discussed earlier, visual field defects in visual pathway lesions. All the type of hemianopias, the homogeneous hemianopias, the heteronymous hemianopias, the macular sparing lesions, the keyhole visions, you have to remember. So this is a common controversy, the keyhole defects. So if they ask about the keyhole defects that are seen basically in vascular lesions of lateral geniculate body, and if they ask about the keyhole pupil or keyhole vision, then it is seen in iris coloboma. So now we just remove this, and I think 5 minutes are. Any questions you have, you can just message me on chat box, and we would try to solve them as soon as possible. So now comes the favorite topic, the miscellaneous topics. You can get about the ocular side effects of systemic drugs. Very important is just do the tables that are required, or the tables like nicotinic acid can cause the cystoid macular edema, the tamoxifen or travoprost can give you cystoid macular edema, the ethambutol can cause color vision defects. So the ocular effect of systemic drugs, I cannot emphasize more that this is one of the most important topics in ophthalmology. Then you have to basically read about the important systemic things which has ocular manifestations like HIV retinopathy. Last time they have asked about the sickle cell retinopathy. There is an investigation of choice list in my notes in my app. You can just see that what are the investigations of choice for the retinal detachment, what is the investigation of choice for let's say macular edema, what is the investigation of choice for Coats disease. So the investigation of choices is important. Just remember regarding how to do USGB scan. Remember, they have now given the videos in the AIMS exam. You can get similar videos in your NEET exam, and they can ask about what is the procedure that is going on. The most common list, yes, a bit irritating, but you have to remember that what I have done for my students is that I have given the most common in retina, the most common in oculoplasty, the most common in glaucoma, and also given a lines in ophthalmology and lasers in ophthalmology. Two important lasers that I want to tell you is the femto laser. Okay, so femto laser, so many times asked, is a photo disruptive laser. Remember, the excimer laser that is also being used is a photo ablative laser. So femto laser is a photo disruptive laser with wavelength of 1053 nanometer and the frequency of 10 raised to the power minus 50. So these are some topics that you have to basically remember and basically revise. You get some good questions regarding the eyelid and lacrimal disorders. In JIPMAR, you have got a question regarding the epiblepharon. So many times you get a question regarding the nasolacrimal duct operators. And important controversy there is that most common eyelid tumors. Remember, the most common eyelid tumor, if they ask, don't go by the Indian textbook, go by the reference of the the Western textbooks, that where they have seen all over the world the most common tumor, that is the basal cell carcinoma. If they ask specifically about most common upper eyelid tumor, then go for the sebaceous cell carcinoma. Otherwise, if they ask most common eyelid tumor, go for the basal cell carcinoma. Leg ophthalmos, madarosis, poliosis, these definitions are important. Ptosis, type of ptosis, the Marcus gun joint winking phenomena, the treatment of the ptosis, that is important. The blowout fracture, you have to remember. This time in JIPMAR exam, they have asked about the panda sign. So you have to know that there is an anterior cranial fossa fracture that can cause panda sign. The dry eye and evaluation test like Schirmer test, you have to remember. The lacrimal apparatus You have to remember what are the tests used for the evaluation, like Jones test, like syringing and probing, that you have to remember, the scintillography that you have to remember. And in the Graves ophthalmopathy, there are various signs like Mobius sign or the Coke bottle sign. So these signs you have to remember. Final, uh, last but not the least, it is the glaucoma that is important. One of the most important chapters in ophthalmology. You would get a question, very important. You think and you remember that if they ask the investigation of choice for measuring intraocular pressure, it is Goldman applanation tonometry. Don't get confused regarding the things that the best tonometer or most precise tonometer. If they ask specifically about the intraocular pressure, the only thing that is validated is Goldman applanation tonometry. Now they can ask about the type of fields also. Two important controversies that you are having. If they ask drug of choice for primary open angle glaucoma, it is always a PG analog. And if they ask drug of choice for primary angle closure glaucoma, it is pilocarpine. Don't think or don't get confused with few lines in a textbook where they say that pilocarpine may not be used. Pilocarpine still is the drug of choice for primary angle closure glaucoma. But if they ask about the treatment of choice, it is the laser iridotomy. Remember the trabeculectomy, that is the filtering procedure, that is only reserved in 3 cases. The patient has intraocular pressure that is not controlled on maximum medication, the patient cannot follow up regularly, or the patient has allergy with the anti-glaucoma medication. Only then do trabeculectomy, otherwise it is not a treatment of choice for any type of glaucoma. New innovation in glaucoma is the valves, and you have to remember the name of Ahmed glaucoma valves that can be used in secondary glaucomas. The lens-reduced glaucomas, very important and very easy. The phacotopic one and the phacomorphic one. Remember, these are secondary glaucomas. The phacoanaphylactic and phacotopic ones are the secondary open-angle glaucomas, and the phacomorphic one is secondary angle closure glaucomas. Some miscellaneous glaucomas that you have to remember, like in Sturge-Weber syndrome, you get increased episcleral venous pressure. That's why you get glaucoma. And sometimes you can get a question regarding the malignant glaucoma. That is a complication of the intraocular surgeries where the anterior chamber depth is basically less in the center as compared to periphery. So friends, with this, I complete my discussion regarding how to approach ophthalmology in NEET exams. I have given you a list of important topics. You can, any doubt, you can personally message me also. And we would be looking forward for you in the coming session by Dr. Tenzin, who would be taking session regarding the strategy PGME. And I hope you like the session. Any doubts, you are more than welcome. And I wish you a lot of best wishes for the NEET PGME 2019. And also for those students, I thank you for attending the session. Hope you liked the session. Please give us a feedback. And we wish all the best from my side and from the team Kaplan. Thank you.